Hello, in today's session we will discuss about pyloric stenosis. Pyloric stenosis was from ages called as congenital hypertrophic pyloric stenosis or CHPS, but of late the nomenclature has been changed to infantile hypertrophic pyloric stenosis or IHPS. Why was this change in nomenclature? The reason being, in congenital conditions the pathology is there at birth, but in pyloric stenosis the pathology or the hypertrophy of the pyloric muscle is not seen at birth, but it occurs subsequently. So now we call it as IHPS rather than calling it CHPS. What is pyloric stenosis? Infantile hypertrophic pyloric stenosis is hypertrophy of the pyloric muscle resulting in narrowing and obstruction of the pylorus, which leads to gastric outlet obstruction. So the baby will have recurrent vomiting of whatever the baby is fed. The incidence is about 1.5 to 4 per 1000 live births. Infants present at 3 to 4 weeks of life, and we do see a strong male predominance. This is commoner in the firstborn male baby, and the incidence is up to 2 to 5 in male babies compared to 1 in female babies. What is the etiology? As of today, we still have various hypotheses, and it's called a multifactorial etiology, with various hypotheses claiming that it can be hereditary, there can be genetic factors, and also milk protein allergy, especially if cow's milk has been given to the baby. And there are cases where they have hypothesized as abnormal innervation of the pylorus as one of the causes. What happens in pyloric stenosis? The abnormal hypertrophy of the pyloric muscle leads to obstruction of the gastric outlet. The pylorus gets blocked, and whatever the baby is fed is collecting in the stomach, and after a few hours the baby starts vomiting. This leads to repeated non-bilious vomiting, which is often projectile, and it leads to dehydration and electrolyte imbalance and also acid-base imbalance. So what are the various electrolytes which are becoming abnormal? Will come to as we discuss the pathogenesis further.